The abdominal aorta, the largest artery in the region, is cause for major concerns in the elderly population. It begins around the diaphragm until it reaches the two iliac arteries near the pelvis. The vessel is comprised of three layers: the intima, media, and adventitia. The aorta is comprised of a large amount of circumferentially arranged smooth muscle, making it a very elastic artery. The aorta is the primary branch extending from the heart that supplies blood to all major organs and extremities of the human body. Any issues that arise with the aorta are not only problematic, but fatal if not treated quickly. An abdominal aortic aneurysm is defined as a dilation of the wall of the aorta, which can occur at any point along the vessel. More specifically, aortic aneurysms are defined as a dilation of more than 150% of the diameter just proximal to it. Additionally, an increase in stiffness is commonly associated with aortic aneurysms. Around the age of 60, the risk of developing an aortic aneurysm begins to increase. Men are four or five times more likely to experience it, and women are more likely to experience a rupture. Additionally, smoking and hypertension significantly increases that likelihood. Approximately 90% of aortic aneurysms are discovered by accident, and they have an asymptomatic progression, which can prove dangerous as a diagnosis generally occurs after a rupture of the vessel. Traditionally, aneurysms have been treated with surgery. However, this method has been associated with extended recovery times and high mortality rates. More recently, vascular grafts are installed using an endovascular approach. When placed within the aneurysm, the graft provides an alternative conduit for blood flow within the patient's vasculature by excluding the aneurysmal sac from blood flow and pressure. Overall, innovative graft solutions are working to treat abdominal aortic aneurysms, the 13th leading cause of death in the United States.
The aorta begins at the top of the heart with a diameter of about 7.6 centimeters in the ascending loop and tapers to a diameter of about 5 centimeters in the abdomen. This size varies with age, but does not vary between genders except for a small 1.4 millimeter difference in diameter, which is not that significant. At a diameter of approximately 7.9 centimeters, the need for medical intervention has increased to 40% of cases.
There are currently 5 abdominal aortic grafts approved for clinical use by the FDA. The devices all share similar geometries and implantation procedures. They are inserted with a catheter through an incision in the recipient's thigh. The device utilizes several different combinations to maximize durability and flexibility. Common materials for contemporary stents are typically self-expanding nitinol or a stainless steel mesh supporting a woven polyester structure.
In order to implant a vascular graft into a patient successfully, the mechanical properties of the synthetic graft must be taken into account. This is vital in order to prevent post-operative complications. Complications are usually due to a technical aspect of the replacement graft itself. This involves structural integrity and stability of the graft. Rupture of the graft, infection, and the creation of a thrombotic occlusion are also all potentially serious complications. In order to prevent potential complications, the vascular graft should have similar mechanical properties to that of native tissue. Specifically, mechanical properties that are important include elastic modulus, stress and strain, pressure, compliance, ascending aortic velocity, and blood fluid properties. It will be assumed that blood is considered a Newtonian fluid with laminar flow in the abdominal aorta. A normal abdominal aorta has a diameter of slightly less than 3 centimeters. The diameter of the aorta increases with age, along with the thickening of the vessel walls. The elastic modulus ranges from 4 newton per centimeter squared in young adults to about 10.4 newton per centimeter squared in middle-aged adults. In the elderly, elastic modulus of the abdominal aorta is closer to 14 newton per centimeter squared. Circumferential stiffness is approximately 330 newton per centimeter squared, and the stiffness, which is the inverse of compliance, is about 5.82 newtons per centimeter squared.
An abdominal aortic aneurysm is defined as a dilation of more than 150% of the proximal diameter of the wall of the aorta, which can occur at any point along the vessel. An increase in stiffness is also commonly associated with an abdominal aortic aneurysm. A patient suffering from an aortic aneurysm is at risk of vessel rupture at the site of the aneurysm. An aortic aneurysm is commonly treated with vascular grafts implanted using an endovascular approach. Current FDA-approved grafts attempt to replicate the geometry and physical properties of a healthy aorta using synthetic polymer grafts supported by metal stents. Ideally, future treatments for the abdominal aortic aneurysm will improve on current success rates by implementing a design that emulates native tissue.